Hello, come on in.
Hi, how are you?
I'm fine.
My name is Susan. I'm the nurse who's going to be doing a physical exam on you. And before I do anything, I just wanted to know that if it's okay with you to videotape you, because the video will be seen by a professor and other professors or students. And is it okay with you?
Yeah, it's
It's
fine.
fine.
I love students.
Okay. So I'm just going to go wash my hands and I'll be right back. Can you please tell me what your name is
Miss Emilia. You can call me Miss Emilia.
and what's your birthday?
Do you really want to know that?
Yes.
Okay. 1111.
This is just to make sure I have the right patient. So, so I'm just going to do a head-to-toe examination, this assessment, and some will require touching. So I hope you're okay with that. Okay. So I'm going to check here. I know before doing anything, I know the vital signs were done by the CNA outside. So your vital signs everything seemed normal. So now I'll just check your skin and I'll just see how you appear. You appear good hygiene, everything seems good. So I'm going to inspect your skin, okay? So just check your arm. It's great. Yes. Okay, so I do not see, the color seems very good, the turgor is good, and you're well hydrated, no scars, no edema, alright, no swelling, okay? No lesions, no scars, I said, and I'm just going to look at the palm of your hand. Your hand seems fine, no lesions or anything. And your nails, your nail bed seem good, no clubbing. You have good capillary refills. So the palms are great. So I'm just going to check in the back, okay, and make sure your skin is okay also in the back. Alright, your skin is good, no lesions, no scars. So now I'm just going to examine your head. Okay, the size of your head seems normal. Okay, you have a great shape. Your head is not too big. It's just normal for you. And your hair texture is great. You've got lots of hair and no alopecia, no baldness anywhere, and no hair loss. Okay. So I'll just look at your face. Can you smile for me? Okay, wonderful. So there is no facial drooping, nothing. Alright, so I'm just going to feel at the back of your head, just your occipital nodes to see. Okay, it's fine, no nodes. So now we'll just check your eyes, alright? And is it okay if I just ask you to remove your glasses? Do you mind? Okay, you can just hold on here. Are you okay holding on to the glasses? Okay, so I'm just going to assess to see your eye placement, and it's nice and symmetric. Okay, it's great. And then I'm going to check your scleria, okay, and your conjunctiva is nice and pink, and your extraocular movement. Okay, so just follow my finger. Wonderful. Okay, so I'll just see if you have any red reflexes, the arteries, any veins, any bleeding. No, everything seems fine. The disc and the mark is good. Okay. So I'm just going to also see for your visual, to see the acuity. So I'm going to give you just like a test, a reading test, and I have to be 20, you have to be 20 feet away. It's just a chart that you're going to read, okay? So the chart, you just close one of your eye, okay, and just see what the chart says. The top line.
EMIC.
Okay. Do the same on the other one.
EMIC.
Great. Okay. So I'm just going to get the light. I'm just going to check your pupils. Okay. And so I'm going to see the size of your pupils and if it's reactive to light and the shape of it, okay? Great. Symmetric is right, it's reactive to light, direct concentral, and the accommodation is great, okay? So also just going to access the extraocular movements, including conversion, looking for any conjugate, any gaze, any stigmas, any lid lag, which you don't seem to have any lid lag. So I'm just going to inspect your optic disc. Okay, the color, the clarity, and the outline, the size, and the psychology looks great. Okay, and everything looks fine. Yes, yes, I'm sorry. Thank you so much. And there is no active edema, so it's great. So now I'm just going to check your retina and the arteries. I think I'm so sorry. Okay. No redness, no arteries or any bleeding, no lesions or mass or any hemorrhage, okay, or no fovea, macular or exclude cyst I've noticed. Okay, seems fine. Yeah, seems great. Do you have any problems with your eyes? None at all. Okay, so this next I'm just going to check your ears. Okay, so your ears seem symmetric. Okay, you have any hearing problems? No. Okay, so I'm just going to see if you have any discharge in your ears. No discharge. I'm just going to give you like a little hearing test. I'm just going to mention something in your right and then left ears, okay?
How are you? You look beautiful.
Yes. You do. You look very nice. Okay, so the next thing I wanted to see the tympanic membrane. Okay, so I'm just going to check to see. Okay, it's nice and pink. Okay, this color is good, no issues. Okay, so much. Okay, tympanic is clear, it's nice and pink, no problems. And the next, I'm just going to check let you lift your head up for me, your chin. Just going to look at your nose, okay? The nares are good, the septum is okay. There is it's good patency, no discharge. Okay, wonderful. You don't have a cold, so that's great. So next, we're just going to move on to the mouth. Okay, so you just smile. Okay, and just open your mouth for me. Go okay, your tonsils are okay, the vulva is good. Okay, the gums are nice and pinkish. So no, and the dentition is good. Okay, the palate, open your mouth. It's nice and soft. Hard palate is okay. The soft palate is okay. The hard palate is okay. So I'm just going to just give you a little test to see the gag reflex. Okay, just open your mouth. Okay, great. You have a gag reflex. Okay, let's just see I'm just going to look, okay, for any inguinal hernia. And we did occipital already, so occipital is good. So I'm just going to look at your neck. Okay, so the neck seems great. So you're just going to turn your head to the right, turn it to the left, up and down. Do you have any pain? No? Great. So I'm just going to feel for your trachea. All right. Can you swallow for me? Do you have any pain?
No.
No? Just going to feel, okay? The symmetric is great. No mass, no scars, no lesions. Okay. So that seems great. Okay, so we're going to look at the thyroid. Okay. So yeah, thyroid is okay. All right. The size is good. The symmetric is good. Consistency and no tenderness, right? Okay, so now the next we're just going to move to the chest. Okay, I'm just going to look at your chest. I'm going to examine the skin. Okay, to make sure you have no lesions, no scars, and the color is good, and the temperature is good, and no bruising over there. Everything seems fine. So now we're just going to inspect to see if you have any signs of symptoms or any like distress when you're breathing wise. So you're breathing normal. Okay, the rise and fall of your chest is symmetric. Okay, and let's see, you're doing great. Okay, so next thing we're going to see for any obvious abnormalities or deformities. Okay. Okay. Wonderful. Okay. And where is it? Okay. So I'm just going to just listen to your chest. Where is my stethoscope? Okay, so I'm just going to let you turn a little bit for me. I'm just going to palpate and check for the symmetry. All right, the tactile firmitus. Okay. Caution. Okay, posterior. Okay, so everything seems normal and you have no problem breathing. You're not short of breath. So wonderful. So I'm just going to auscultate and then I'm going to take a deep breath. Your lungs are nice and clear. There's no problem. There's no wheezing. Everything is fabulous. Okay. All right. And let's see. So now going to listen to your lungs even in the front. Okay. Take a deep breath. Everything seems fine. You're not wheezing. You seem like you're not in any distress. Okay, so now we're going to do the heart. Okay, so far we're doing very well. You're doing great. Are you okay?
Yes.
We need a little break.
No.
No water or anything.
No,
Break?
I'm fine.
Okay.
Thank you.
So I'm just going to feel for your carotid arteries. Okay, just feel it for the pulsation. Okay, it's great. I'm going to auscultate for any grooves on your carotid artery. Great. Everything seems fine. So now I am going to let you sit down. I'm just going to listen to your heart, okay? So I'm going to listen to the pulmonic. Okay, so I listen. The aorta is great. The pulmonic is good. The Erb's point, tricuspid, and mitral. Sounds good. So now the rate seemed like it was normal. Okay, and the rhythm sounded okay also. Okay. So now I'm just gonna have you lay down. Okay, I'm going to put the head of the bed at 45, just a little. Are you comfortable?
Yes.
Okay. Alright, so I'm going to do the same thing. I'm going to listen to your carotid artery when you're laying down. Okay, I'm going to listen to your mitral, pulmonic, Erb's, tricuspid, and mitral. Okay, and the PMI is on the 5th intercostal, mid-clavicle. Sounds great. So now I'm just going to have you sit up. Okay, so alright, so we did the jugular at 45 degrees. I didn't do that one. I'm just going to do that one, okay? So the head of the bed is 30 to 45 degrees. Just going to listen to your carotid. And and your jugular veins are not distended. They look wonderful. Okay, great. So that ends our physical exam. How are you feeling?
I'm feeling fine.
Yes. Thank you for giving me the opportunity to do the assessment on you. And I just wanted to let you know if you feel anything abnormal or any issues you have, you just go check it out with your private physician. Or if you feel you're in any distress, you call 911. Until then, I will hope to see you next year to another annual physical on you. Thank you so much for giving me the opportunity.
You know what?